Hi guys, and good morning. So I am here today just to kind of vent a little bit about some things that disturbed me all night long because most of you guys are aware that I went through my fourth pregnancy having HG. And my very top issue was not just the nausea, the vomiting, and all of that. It's the way that physicians and medical teams do the care now, and how easy it is to gaslight patients and dismiss things. There are still some good physicians and doctors out there. However, it is so easy for them to dismiss what goes on with you, the symptoms that you're having, and tell you that it is normal. And it is crazy because not only during my pregnancy did I hear so much about what was normal with my labs, what wasn't normal. Even the latter part of my last pregnancy, I realized that I did have some high blood pressure that went as normal, even though before pregnancy, and to my knowledge, other pregnancies in which I have to honestly go back and look, because I wasn't diagnosed even with HG until my third pregnancy. So there's no telling what else they overlooked even with those, because they had enough evidence and labs to diagnose me with HG with my first pregnancy. And it's like, it's stressful, especially when you are a parent, a woman, a mom, and it's like, it's so bad. Like, I really hate going to any doctor visits without my husband. I hate going by myself. I don't like it. If I have a visit, I really prefer for him to go, because if not, then gaslighting is most likely to happen, in my opinion, for me. And it's like, I get better respect when he is there with me, because I don't wear my ring. The reason being is that when we left our apartment, my ring was there. And also during my pregnancy, my fingers would swell up, so I wouldn't have my ring on. Therefore, even if I put that I have a spouse or husband on there and I show up by myself with no ring, I don't think people actually believe that I did, or they thought he was just a boyfriend, or whatever. And it was just like, the type of treatment I would get without having one there or someone there, it was just totally different. It created so much anxiety and even fear to even go to a doctor without having him. That was absolutely no way. I couldn't really drive myself anyway, so that wasn't gonna happen. But now that I am postpartum, well, even in that pregnancy, there was one hospital that would tell me that, okay, we're gonna take her back first and we're gonna triage her without you, and then we'll come and get you. And I'm just looking at them like, oh hell, heck no. And it created so much anxiety for me, just those, what felt like hours for me, but it was like minutes of them doing things, going through the typical surveys or whatever else. Even if they had done that survey before and I wasn't new, I had just been there the week before, you would do the same thing. And it was just like, okay, I'm tired of this. And it was just crazy. It was crazy. But now in postpartum, I've gone to doctors myself, and even then it still seems as if going to one with my spouse is easier than going to one without my spouse, because then someone's there to let them know that I'm not mentally making this stuff up. I'm actually having these symptoms and I am in pain, and even though, it's better, it's still there. I went to the neurologist yesterday, and he's like, well, yeah, your x-ray, they did an x-ray. Mind you, I've already been in a car accident prior to my pregnancy where I was treated for the disc that is in my back that I know that is there. And it's like, well, did your x-ray? The x-ray came out fine. I bet it came out fine because you're not going to see a disc on an x-ray. Not that one. You're not going to see it on the x-ray. It's not going to show you any details of that. And of course, even though I came in there and checked off some symptoms and things like that, it was still, all he heard was, it's not as bad as it used to be. It's better, or it's getting better, even though, you know, the pain is still there in my lower back, XYZ. But it was like, oh, okay, well, pretty much, you know, dismissing that and come back as needed. So, yeah, I plan to write a letter to them and let them know that I don't agree with whatever they've done, because to my knowledge, when I asked before why an x-ray was ordered, of course, for insurance purposes, they have to start with that. So that's what was done. And then I had to do the back exercises. Okay, I didn't do their back exercises. I did do my own at home, which is what I told him. And I told him, no, I did not take the medicine that they gave me because I breastfed and I wasn't comfortable taking anything while breastfeeding. I take the Tylenol, I take the ibuprofen or whatever. And he's like, well, it's like ibuprofen. Okay, but if I don't need to take it, I'm not going to take it. Yes, I do have pain and everything like that, but I need to be able to do things, function. Taking a muscle relaxant and all that doesn't work. It doesn't work for me. And I've took so much medication during my pregnancy and everything to the point where I don't even want to even take Tylenol, ibuprofen. I don't even want to take Tylenol no more. See another Tylenol. But if it's bad enough, then I will. But I've learned to manage as a mom before that with certain pains. You know, I just went through birth. So, no, the pain is not as bad as that. It's not as bad as that. So if I can handle that, in which I did do the epidural again, and I'm not sure what strength of epidural they used, but I couldn't feel anything. And it's just, I don't think that really helped either, because I did have the back pain throughout my whole full pregnancy, and it was so bad towards the end that there was no way I could sit there and try to push without having the epidural. Something had to help me. I was in pain for weeks. And well, my back pain actually started early in the first trimester, going into the second, and progress more into the third. And nobody really listened to that. And then you had to fight insurances with even trying to do physical therapy, which wasn't even written a referral to until my third trimester, and they didn't have an appointment for me until after my due date. So yay. The ones that did try to get me in early, there was an issue with my insurance, or them taking my insurance, because someone said they didn't take it, but then according to online on their website, they did take my insurance. Now, in this pregnancy, I did have to go from, you know, the job insurance to Medicaid. So that was fun. That was fun. And even with that, it was tough, because my doctor OB that I had seen switched to, that was like the second one I had seen, I had switched to that one, told me they didn't take Medicaid, which didn't make sense. But in the end, with me having to switch, I switched over to a different doctor. That was not a great experience either, because when you switch so many doctors, everybody's looking at you, And of course, gaslighting was already happening during my pregnancy. So, of course, whatever was in their notes, of course, me at the time, I didn't think to check my notes and things like that. I didn't start checking that till like second trimester to look at my notes and what doctors were actually putting in there versus what I was telling them. Even the hospital, when I would go and complain things, they would dismiss things. Oh, these labs are normal, la la la. We're expected these to be elevated because you're pregnant. Okay, I'm also pregnant. I'm also having trouble eating, keeping things down, la la la. And when I would get dehydrated, they're like, well, how did you determine that you're dehydrated? Well, first of all, I know to look at my urine. I know to look at these signs. I've been dehydrated a lot. You're looking at the fact that I've started gaining this unexplained weight that you guys still haven't told me why I'm gaining this unexplained weight, because I eat, but I don't eat like you think I do. But yet I am gaining weight, only to find out after postpartum through a company that my insurance has that I probably most likely had gestational diabetes again, due to the fact that I had it the pregnancy previous to that one, and it just wasn't diagnosed, or it was overlooked because of, I don't know, maybe because of the test. I don't think that they did the test as they should have, to my knowledge. When I did my previous pregnancy with that testing, I had to fast for that one for a certain amount of time and then take the test. Drunk the stuff when I came in or whatever. I think that's how it was done, but not with that one. Not with that one. They did the rapid test. They did the one where I drunk the stuff. Eventually they tested that again, because I had to do it twice, and they said it was normal, but I could feel the same symptoms that I had with my previous pregnancy when I did have gestational diabetes. The symptoms when I was eating certain things. I had not been eating sweets for so long because it made my nausea worse, and when I did eat them, or after eating them, my energy and everything would stop. It felt like everything would just go down, and I would definitely have to eat in the mornings and stuff like that. After going so long without it, I could feel my sugar dropping, and it was just like, it wasn't always like that. Well, it was off and on, but I really couldn't tell because I was so weak in the beginning to begin with, and I wasn't eating that. When I didn't eat, it kind of felt normal to feel like that. But even then, when I started eating, it was still, I don't know, it was a lot. I don't even know how to explain it. I don't even know how to explain how I feel. Talking, navigating for myself was very hard, and it still is hard, because I can tell within minutes of me being in a room with a physician and how they talk to me, how they word things, I can tell when I'm about to be dismissed. And until now, I started researching, I guess, like what to say and how to say things, how to word things when I'm there. So I will begin to use those things, and I will be reaching out to the doctors and just, I don't know, letting them know that I'll be getting a second opinion. I will be pulling my records to get the notes and things from that, and if they are not correct, then I will just let them know. They can add notes. Most likely they won't, because I've tried this before during my pregnancy. They literally asked me from the hospital I went to, well, what would you like us to do? Because I asked to speak to the doctor or whatever. Of course, the doctor wasn't available, the one that had in my note. And it was just like, well, we could just put a note in there and XYZ, and that was it. But how often, who's gonna look at that little note that y'all put in there? Some may will, some may not. is a lot, guys. When I say going back and forth to the hospitals and doctors has definitely traumatized me, it is a lot. And it's like, it's difficult to do things already as a mother, to find that time for these appointments and take yourself to them, on top of the kids that you have that have to go to the doctors when they're not feeling well, they're sick. And that is a whole nother thing. My skin is so dry. That is a whole nother thing when it comes to my kids and their births and my experiences with them. Is horrible. I would love to say that I've had a good birth story. I will say with this fourth one, the nurse that I had and the person that delivered my baby, I will say that they were great. They were great. And getting the epidural, whoever that person was, they did an excellent job. I know I couldn't feel anything or whatever after he had done it, but I will say that he did a good job. However, it was after the birth and moving to the other room that made my experience just crazy. I hate it. Not every nurse, I don't want to say hate is a strong word, but there were some that was just like, if I told you I was in pain or told you this was a problem, you wouldn't listen to me. Like, I had really bad experience with constipation throughout my whole pregnancy and after. And at the postpartum care, after the delivery at the hospital, I had hemorrhoids already, internal ones. And I tried to tell them that I couldn't go to the bathroom for, it had been at least a day or two after the delivery when I was still there. And I tried to tell them, like, okay, this stuff isn't gonna work. You're gonna give me something, a pill to swallow, me swallowing pills. That way, that stuff doesn't work. The Miralax doesn't work for me. It still takes a very, very long time, and I'm severely in pain right now. Do you not have anything else rectally to take and do? They still wanted to try the Colace. They still wanted to try those things while I'm eating at this point. My body is digesting this food, and I cannot eliminate anything. So they were going to dismiss me without me going to the bathroom. They were going to send me home in pain until I was damn near crying at discharge in the bathroom because I couldn't go to the bathroom and I was hurting, and it was hurting me at that point very badly. Push come to shoves, I ended up having one of those things shoved up my butt after I told her I had internal hemorrhoids that were already inflamed because I had been trying to go to the bathroom but couldn't, so all that pressure caused them to swell up, and here you are shoving this thing up my butt, and I'm telling you that it's painful. She's like, no, I know it's a little uncomfortable, not a little uncomfortable. You are shoving this thing, and you are shoving it through my hemorrhoids with no care in the world. And you don't care that I'm telling you that it's painful because you did it not once but twice. Anyway, push forward now. I still go with I'm still in the process of gaslighting, including my OB and the neurologist. And it's like, I can tell by the look on their face, they want to tell me, oh, it's just all in your head. There is nothing wrong. Yes, there is. And with the symptoms I gave you yesterday, that I was having headaches and other things, you looked at those symptoms and still told me to come back as needed. Because the only thing you needed me to say out of my mouth was it was better than when I first came in. But when I first came in, I was just like a month or so postpartum. So of course it was still very painful for me. I still had a lot of the weight and things. If you no longer wanted me there as a patient because I didn't take the medicine you gave me, well then say that. If you felt like I was supposed to just agree with what you have given me, and that wasn't as needed medicine anyway. So if I did not need to take it, or I could do with that Tylenol and ibuprofen, so why do I have to take this medicine? It was a suggestion, and that's needed. It's a muscle relaxer. I didn't need a muscle relaxer. My bones, my back. And yes, it did ache the muscles around it when it was flamed up or whatever. I've had issues before with my sciatic nerve in my back. Again, I've had epidurals before. So I really don't know what to tell you when I know where I feel the pain, and it's not muscular. I can feel it, like my bones, my joint, my hip to my spine. And that was one of the problems that I had even during pregnancy. But I couldn't get any tests done, or more tests done, other than if they did an x-ray during my early pregnancy. But that wasn't going to show anything with disc. So, of course, I don't know. But, again, just venting. Because I really don't know what to do at this point. I really don't want to see another doctor or go to another physician. At least not here. So, yeah.